Good afternoon, everyone, and a warm welcome to our CIFER webinar series. I'm Petra Meyer, CIFER Consortium Director and Professor of Public Health at the University of Glasgow. Over the past 5 years, CIFER has brought together policy and academic experts with practice partners in Scottish Government, Public Health Scotland, Greater Manchester Combined Authority and Sheffield City Council. We use innovative system science approaches to improve public health and well-being and tackle health inequalities. This webinar series of short lunchtime talks offers you the opportunity to hear directly from our team about this exciting work. Each presentation also gives you the chance to ask questions, and a full recording will be available on the CIFER website after the event. To submit questions, please just use the Zoom question and answer box, and we'll come to these at the end of the presentation. So, today, I'm delighted to introduce our speaker, Dr. Corinna Alsenbroich. Corinna is a reader of computational modeling and co-director of the CIFER Consortium. She's based at the University of Glasgow. And in today's webinar, she'll explore how CIFER's unique interdisciplinary system science framework generates new insights and can help transform overwhelming complexity into actionable solutions. Please feel free to submit questions anytime. Corinna, it's over to you.
Yeah, thank you very much, Petra, for this lovely introduction, and welcome to this webinar. So I have joined CIFER about 3.5 years ago, so not quite there from the start, and it has been quite a roller coaster of being part of a really large, interdisciplinary, complex, and distributed consortium. And I'm going to reflect on these last 3.5 years with CIFER coming to an end. What is the uniqueness of CIFER, and how this approach really helps us to negotiate complexity in a new way. So this is the CIFER wheel, the mnemonic that works, that lets us understand CIFER. It is a circle of interlinked work strands, each of them having 1 or 2 methodological expertise or sort of practical expertise aspects, and it is all surrounding the partner policy processes, and that is really very nicely depicting what CIFER is. And what CIFER does is it's using complex systems modeling to inform healthy public policy to improve well-being and reduce health inequalities. So there is a simple task, in a way, to do policy support to solve really difficult problems, and CIFER is building a workflow or a working environment through which to find solutions. So what is the problem with complexity in the first place, and why do we need a new approach? Old scientific approaches or traditional scientific approaches are fantastic to do particular things, and what they do is they compartmentalize the world, they measure things, and they try to control in experiments, for example. And we're trying to squeeze the world, the complex world, the difficult world, into little compartments and analyze those, and then make recommendations out of those. But of late, there has been an increasing recognition that that really doesn't work, and that we're living in a complex and interdependent social world in which we probably cannot go as far as we would like to go with traditional methods, in particular with methods that are carving up into disciplines and into policy silos. So taking a complexity lens is really starting to understand the interdependency of the social world, the heterogeneity of populations, that we might not be able to measure things, that we can't compartmentalize, that we have to take whole systems approaches, and that we have to grapple with uncertainty. And this is really what CIFER does. It is trying to transform overwhelming into actionable complexity by bringing shape into the amorphous. That's sort of the tagline for my talk. So what is the problem with complexity in the first place? Well, really, there are 2 problems with complexity. And these are depicted here in a two-dimensional sort of space. Complexity has two aspects to it. There is a sort of complexity science aspect to complexity, which is that complex systems are systems consisting of multiple interdependent components. And that is a view of complexity that is very much assessed, as I said, from the system science, from the complexity science perspective in the Santa Fe Institute in computational modeling approaches, agent-based modeling, maybe system dynamics. And these kinds of modeling approaches are trying to tackle complex systems as systems of multiple components. But there's a second view, or a second component to complexity, in particular to social complexity. And that can be summarized as a multiple view kind of complexity. And that is very nicely summed up in the work by Paul Sillier on complexity and postmodernism. And that is a conception of complexity that really takes seriously that people experience the same complex system in different ways. People have different experiences of their schooling, for example, even if they're in the same school. So there is a recognition that the social complex system is composed of different views, different experiences, different meanings, and different purposes by the different people that are living within the system. Now, the traditional scientific methods are sitting in the bottom left-hand corner of this space, of this two-dimensional space, statistical methods and experimental methods, and they're fantastic. They're really good at providing us with fairly certain and close to agreement answers to questions. The problem is that they're also just largely answering simple questions. So the further you're getting from simple and well-defined questions, the less useful these methods are. And the recognition of this complexity space brings about new methods, like constructivist methods of interviews and in-depth interviews, etc., where you're really getting into the experiences of people and understanding the different meanings and experiences, as well as simulation methods, as I said beforehand, in the Santa Fe Institute in the multiple component type of complexity. And CIFAR sort of lives in this two-dimensional complexity space by, if you think back to the CIFAR wheel, we had 7 work strands with different methods and different approaches. And these approaches are in this two-dimensional space of far from agreement and multiple component complexity. So, for example, we have community panels and policy analysis and policy co-production as one part, which is really grappling with the many views and many different experiences that people have of a complex system or of the complex social system. We have systems mapping, evidence and gap mapping, and discrete choice experiments, which are trying to make sense of far from agreement and far from certainty, complex component kinds of complexity. And we have computational modeling tools that are grappling with heterogeneity, with change over time, and optimization problems. And what CIFAR does, it doesn't just have all these methods, it is bringing these methods together so that we can actually produce solutions within the complex space of many views and many components, and establishes, as I said, workflows and interdisciplinary collaborations that bring about actionable complexity. So CIFAR really tackles both the multi-component part with computational modeling, and that is work strands 4 and 5 here on the CIFAR wheel, and work strand 7, and the multi-view part of complexity with co-production, systems mapping and societal evaluation in work strands 1, 2, 3, and 6. So this is the backdrop of what is unique about CIFAR. It's this really grappling within the two-dimensional space of complexity and bringing together methods across the space to start tackling problems. So over the last 5 years, CIFAR has developed a range of tools. They're all available on the website. The website link is down here. And I'm just going to walk you through a little example of how this integration of different methods works in order to produce outputs that can be used by policymakers. And here we have, in the middle, there are 4 reports that are looking at specific policy problems of health, of life expectancy, inequalities, of mental health, of housing and health, and surrounded by the tools that we have. So I'm going to start with an example of the dynamic systems model and how that comes about and how that is used or can be used in order to negotiate complex problems across local authorities. So CIFER sort of started off with the question of the inclusive economy and how the inclusive economy or economic inclusivity relates to health and health inequalities. And it all started off with systems mapping, participatory systems mapping exercises, and with the policy partners. So we have 3 policy partners, and we did systems mapping about the inclusive economy. And these systems mapping sessions were then aggregated into a systems mega map of the inclusive economy. And you can see that here, and it's really complex and has loads of nodes and loads of links, and is mainly there to show you the overwhelming complexity of an inclusive economy, right? But in itself, this is good. This is good to understand that we are grappling with a very, very large, interdependent, complex system. It's not yet actionable, but this is a starting point to say, right, these are areas that we have to really consider. And this was all done by stakeholder and expert evidence. Now, given that this is really too overwhelming as complexity, we started working at whittling down the systems map into thematic areas, for example, the economy, employment, place, and poverty, and starting to produce a systems map that makes sense, that doesn't necessarily get rid of the important interdependencies between different policy areas, but functions at a slightly higher level so that we can see the interdependencies between the areas rather than every single thing that might be interrelated within a complex system. At the same time, we produced a set of indicators in order to start measuring economic inclusivity. And they were again defined by expert or selected by experts, and they were used, or they were put together on the criteria that they have to be about the inclusive economy, that they have to have a publicly available data set underlying them, that they have to have some time series data so that we can measure something over time, and that they have to be available at board level. Okay. Now, this is a sort of foundational stage, which is still in the stakeholder and expert elicitation in the many views area of complexity. Now, the first output from the indicators and the data set that was underlying it was really the inclusive economy data set, which is a beautiful data set, openly available. You can find this on the website. And what it allows you to do, I hope this is okay. What it allows you to do is to look at indicators over time. At the bottom here, you can see the year that you can change over time, and you can see the geographic distribution of a particular indicator across GB. In the drop-down menu, you can look at different inclusive economy indicators and their distribution, and again, look at them over time. We have the health indicators, life expectancy and lifespan variation, which you can look at over time and over the geography of GB. And this data set is very useful to look at the distribution and the differences across the country, but it has also been used for a clustering analysis to understand whether we can identify different clusters of local authorities that have different levels of economic inclusivity. And here you can see the clusters. There's the less inclusive, more inclusive, average, and the mix of extremes, which is sort of the yellow London and somewhere here down in the, that might be Bournemouth or something like that. This clustering exercise led to a publication about looking at the economic inclusivity clusters and figuring out what the relationship is between economic inclusivity and health outcomes here, life expectancy and lifespan variation. And this is sort of a little validation of the starting point for CIFER to say the inclusive economy and health outcomes are really intimately related, and we have to look at economic inclusivity, because what we found in this clustering analysis is really that more inclusive areas have better health outcomes. So this is one of the sort of data-driven outputs that came out of an initial stakeholder and expert elicitation. The second thing that happened with the systems mapping was to integrate the systems map of the inclusive economy and the inclusive economy indicators and produce a causal map for the dynamic systems model. The dynamic systems model is an engineering model, a very data-driven model that consists of a causal structure, a time series set of data, to quantify the causal links, the causal connections between nodes within this causal structure. And so here we have a causal map that is underlying the dynamic systems model. Again, this is a stakeholder-driven or expert-driven exercise to create the map, but it then allows us to quantify through the time series data from the inclusive economy indicators, and it allows us to model through interventions in the system, either at individual intervention points or combined interventions at different points. And what this model allows us to do is to look at how changes at one end of the system percolate through a system given the causal structure that we found here. So it consists of the inclusive economy indicators and some of the health indicators like healthy life expectancy, premature mortality, and SF12 mental and physical health scores. The modeling outputs are showing us here, for example, we have 3 intervention points, which are the employment rate, long-term exclusion from the labor market, and disposable household income. And the model allows us to then model through what will happen to the other economic indicators as well as the health indicators. And it also allows us to look at which intervention points are particularly sensitive and have particularly large effects on aspects of the system. Okay, so here we have a really complicated engineering model that is built, that gives us, that allows us to explore the consequences of system changes across a systems map that is aggregated from different views and different perceptions of the inclusive economy system. And all of that then culminates in a decision support tool, which allows us to explore change and differences in change from interventions across different local authorities, for example, and across questions of healthy life expectancy or health life expectancy inequalities. Yes. So it allows us to think about the solution space of policy interventions, right? Again, this is within the many component, the computational modeling approaches to complexity, but it is all built together to become one tool that is built around different understandings. And we have similar approaches that allowed us to build, for example, a microsimulation tool, the MINOS microsimulation, that allows for subpopulation analysis, and that allows us to better understand who is affected by a policy intervention and how much, and which populations are not, and where we might have to look if we want to measure differences. So in the bottom, in the subpopulation analysis here, we have an upping of the child payment in Scotland, and we can see the differences it will make to income quintiles or families rather than the whole population, for example. And then a final example of how these methods combine is the layered map. And I don't know whether you've been to the seminar last week, but Lisa did a seminar on the layered map, which was really interesting. And this is a map that is exploring housing and health. And it is very much starting from the idea that we start understanding a system by mapping it out, so to understand the boundaries and the interdependencies. But the approach of the layered map is really saying, well, the map in itself is not enough. We also need to evidence the nodes in the map. And the layered map is taking an approach where you can look for evidence from the literature, as well as lived experience evidence that is coming from our community panels. So this is a really rich way of representing a systems map, including evidence. And at the moment, this work is at the systems mapping stage, but it is going to be taken into computational modeling of housing and health. It's going to be taken forward to that. So these are 3 examples of how our tools are constructed and used within CIFAR in order to then produce policy briefs for policymakers to really start looking at the system that they're operating in differently. So this CIFAR is really about the integration of the many views and many component complexities, so that we get to a point where we understand contextualized causality. So that might be different local authorities, so the different clusters that I talked about before, and different inclusivity clusters. They might have different causal relationships that are important of how the economy relates to health outcomes. And the integration of many views and component complexity also meant that we had stakeholder buy-in from the start, because the co-production was there from the start, and they felt that there was a real involvement in saying, well, this is the system we're living in, this is the system we are working in, this is the system in which we have to make policy. And it allowed us to be adaptable throughout. So, for example, we started off with the idea of economic inclusivity, but CIFAR was really, well, the last 5 years have certainly been the most turbulent in my lifetime, given, you know, that we had sort of Brexit looming, but we also had a pandemic, and we had a war in Ukraine and a cost of living crisis. And CIFAR was really able to adapt to these shifting policy contexts by, for example, modeling through a cost of living crisis, including modeling government subsidies for energy use, etc. So the way CIFAR operates and the way CIFAR built the models on contextualized questions from policymakers really allowed it to be adaptable for shifting policy scenarios. So there is the understanding different views, shifting evidence, new policy priorities, which is very much driven by the more qualitative, or the more many views kinds of work strands within CIFAR. And then the geographic disaggregation, grappling with subpopulations and uncertainty that is more dealt with in the computational methods. And all of that together gives us the beautiful CIFAR wheel that, hopefully I've convinced you that this is a unique approach to grappling with with the complexity of a social world in which policy has to be made. Because given that we are living in a complex world, there's really no point pretending we are not. What we have to do is really we have to try to bring shape to the amorphous, and that is what CIPHER does by effectively integrating a range of disciplines, but also a range of sectors, policymakers, etc., into the active way of working. So thank you very much for listening. Any questions?
Thank you so much, Corinna. Yes, as Corinna says, we have opportunities for questions. And if you've not already submitted these, please use the Zoom Q&A box and we will get to as many as time allows. So I've got a first question here. You mentioned policymaker buy-in. Can you provide an example?
Yes, so there was so I glanced over that a bit in the talk. So one of the things that we had was the Scottish Government was focusing very much on alleviating child poverty, and this is something where we could come in and start helping them to think through not necessarily what child poverty alleviation, how to alleviate child poverty. That's very simple. You give more child benefit.